This is Clayton Brown, Associate Professor of Chinese History at Utah State University. I'd like to speak about COVID-19 in historical context, with the subtitle, Viruses in China but No Chinese Virus. And I want to begin with the worst pandemic in human history, known in the West as the Black Death. The disease was caused by a bacterium called Yersinia pestis, which probably passed from marmots, it's a rodent related to prairie dogs, to humans via fleas. Black rats are often blamed for this, but the rats didn't actually directly infect humans. Their fleas did. Genetic researchers have concluded that the plague originated in China, or perhaps Mongolia, and we know it did indeed spread first through China in the 1330s. From China, it was carried westward along the Silk Road, where it arrived in Europe in the 1340s, suggesting how human travel and economic interconnectedness facilitated the rapid and wide spread of this disease. In their study of its origins, the scientists who sequenced the Yersinia pestis genome emphasized that the likely origin of the plague in China has nothing to do with its people or even its crowded cities. The bacterium has no interest in people whom it slaughters by accident. Its natural hosts are various species of rodent, generally found in the countryside, which happen to be found, of course, throughout China. The pathogen only coincidentally passes to humans, and any human population would similarly be vulnerable. In fact, although Europe is typically associated with the plague, it likely originated in China, and the death toll in China was roughly equivalent to that of Europe, about 1/3 of the total population. This was not a European illness, any more than it was a Chinese illness. Now, the most severe pandemic in recent history was the 1918 influenza pandemic, commonly called the Spanish flu. Despite the name, there is still no universal consensus regarding where the virus originated. In fact, it was actually first reported in the United States on a military base. What we do know is that it probably transmitted from birds to humans, and as World War I was ending, the repatriation of soldiers from Europe back home across the globe meant that many of them brought the disease with them. It's estimated that about 500 million people, or 1/3 of the world's population, became infected with this virus. The number of deaths was estimated to be at least, say, 40 million worldwide, although hard numbers are difficult to come by. But the impact was relatively mild on China, perhaps because they had fewer participants in World War I. Now today, we get vaccinated for the seasonal flu, which is actually a combination of this type A strain along with another strain called type B. Because this and other pathogens, that is, causes of disease like viruses and bacteria, these continue to emerge and mutate, so we continuously develop new versions of vaccines to counteract them. Now, the Spanish flu is an example of a zoonosis, or a zoonotic disease, which is when a disease in animals can be transmitted from animals to humans. In this case, wild birds are the natural hosts, and then it ends up passing among humans. Now, many zoonoses cannot transmit person to person, meaning that only the original person gets infected from an animal, but when a new disease is able to transmit from that person to someone else, it can potentially spread to become a pandemic. There is no single source for new pathogens that could turn into, later, down the road, pandemics. For example, 2009 saw a swine flu pandemic that began in North America. It spread across the globe, killed around 17,000 people. Fortunately, it turned out to be less harmful than first feared, but North America has been the source of a recent pandemic. Now, China is a significant and concerning source for new pathogens, including the H5N1, otherwise known as avian or bird flu. This is a particularly pathogenic strain of avian influenza that was first detected among geese in China in 1996 and then passed to humans during an outbreak at a chicken farm in Hong Kong in 1997. And it's since been dubbed the bird flu. It's been detected in poultry and wild birds now in more than 50 countries. So this is especially concerning. Of all of the few avian influenza viruses that have crossed the species barrier to infect humans, the H5N1 virus has caused the largest number of detected cases of severe disease and death in humans. It infects the respiratory tract, causes severe illness, meaning pneumonia, respiratory failure, and has a staggering 60% mortality rate in humans. However, it seems to transmit only with prolonged contact with infected birds and does not readily transmit human to human. But cases of human to human transmission have been documented. So there's great concern that mutations may, in the future, turn H5N1 into a pandemic. And as the CDC points out, in this event it would likely pose a much more lethal threat than COVID-19, for instance. And so hence you have the culling of birds here on a huge scale with the initial outbreak. But even if you look at the date here, February 1st of 2020, there are occasional outbreaks of this that require culling of birds that have been exposed. So this is ongoing. So if we consider the major emerging and re-emerging zoonoses in China, we've discussed already the plague, which is persistent. There are still occasionally cases that crop up. In fact, just a few months ago, right before COVID-19 emerged, there were cases of pneumonic plague in northern China. So the plague is still a threat. Avian influenza that I just mentioned, and also SARS. 2002 to 2003 saw an outbreak of severe acute respiratory syndrome, or SARS. Its origins are still unknown, but the virus has been found in animals, including the civet. It was first detected in China's southern Guangzhou province and then spread rapidly to neighboring Hong Kong, and Hong Kong is an international hub, so from there it spread to other countries, ultimately infecting 8,000 people and killing 774 until it was contained. The containment came pretty rapidly, and since 2004 there have not been any known cases of SARS reported anywhere in the world, fortunately. But SARS is a coronavirus, a family of viruses that includes COVID-19. The current coronavirus outbreak began in Wuhan, the city in Hubei province, and rapidly spread across the globe, causing the current crisis. On February 11th of 2020, the World Health Organization Director General announced the naming of this new virus and its attendant disease. So just like HIV is the virus that causes AIDS, in this case the disease is called coronavirus disease, or COVID-19. The virus that causes it is, this is the long version, severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, and suggests the relationship to SARS, the other coronavirus that broke out in 2003. Importantly, the Director General emphasized that under guidelines established by the World Health Organization and the United Nations, quote, we had to find a name that did not refer to a geographical location, an animal, an individual or group of people, and which is also pronounceable and related to the disease. Having a name matters to prevent the use of other names that can be inaccurate or stigmatizing. Now, there has been a tendency among some to call COVID-19 the Chinese virus, but this is stigmatizing. It would be like calling the 1918 flu pandemic the American virus because the first person diagnosed was in the United States. And given that the human family is a single species and pathogens have no regard for arbitrary political borders, it's important to remember that whatever the origins, we are all similarly susceptible. Overcoming this pandemic will require that we work together.